It's a Northwest lifestyle weekend on Como News. IRG's Health Talk continues.
All right, our next guest is Dr. Kenneth Chin, orthopedic surgeon specializing in foot and ankle surgery and sports medicine at the University of Washington Orthopedic and Sports Medicine Clinic. Lisfranc surgery or injuries, I've heard about this before, particularly in football players. It sounds like it's pretty significant.
It can be significant based on the type of injury and the extent of the injury. But you're exactly right. Football players, linemen especially, are prone to this injury.
All right, let's hear from Dr. Chin and Shannon O'Kelly.
Dr. Chin, welcome to Health Talk. How are you doing today?
Very good. Thanks for having me, Shannon.
Well, thanks for joining us. You're a foot and ankle specialist, I understand. I always like our listeners to kind of get a little background on your practice, your interest, kind of what you do day to day, and kind of tell us about the day in the life of Dr. Kenneth Chin.
Yes, sir. So I work up at University of Washington. I'm one of their orthopedic surgeons. I work out of the sports medicine department, so I operate on athletic injuries and traumatic injuries of the foot, ankle, and knee, but mostly focus on the foot and ankle.
And that's a fellowship. So I understand that you have a fellowship. So you did medical school, you did your residency, and then you went an extra year, isn't it, to do the fellowship in just foot and ankle surgery?
Yeah, I did an extra year of fellowship in foot and ankle surgery and an extra 6 months in sports medicine.
Okay, so tell us, as if we can, I mean, it's a very complex area, the foot is. If you look at your hand, just imagine your hand and you walk on your feet. They're complex areas. Tell us a little anatomy of the foot and kind of some special bones and joints and things we have to focus on, because we're going to talk about Lisfranc injury. So I want to set it up a little bit.
So we can divide up the foot into kind of 3 areas. The front of the foot is called the forefoot, and that's kind of the toe area as well as the metatarsal area. Those are the bones, the long bones that connect the toes to the rest of our foot. In the middle of our foot is what we call the midfoot area, and we'll get back to that later because that's the area of the foot where Lisfranc injuries occur. And then in the back of the foot, that's where the back of the foot connects with the ankle, and we call that the hindfoot.
So I want our listeners to really appreciate your feet. I mean, they're very complex. It's a complex area. A lot of bones, a lot of ligaments, a lot of joint capsules, a lot of nerves, a lot of small muscles. Very complex. And we walk on them every day. And in a Lisfranc injury, that's a fracture of the midfoot area. Can you describe that for us?
Yeah, absolutely. So the midfoot area is complicated. There's a bunch of different bones. That's where the metatarsals hook up with the midfoot bones we call them the cuneiforms. And Lisfranc's injury is an injury of either the ligaments or bones that connect the arch, the bottom of the arch of the foot. And it's really critical to holding up the mechanics of the foot.
And it is an injury that has some very specific mechanics. We see it in some athletes more than others. Let's talk about the mechanics of the injury.
Yeah, so there's 2 types of injuries. There's usually a rotational, it's a push-off injury in athletics, or it can be a high-energy motorcycle or motor vehicle injury. It's
a disruption. So what happens is that torsion or torque in that midfoot area disrupts, tears that ligament, sometimes fractures that bone. Signs and symptoms, I mean, it's pretty obvious when one of these occur.
So sometimes they are obvious. Usually the higher energy ones are very obvious, and the x-rays that we get, you can see that the bones can be either dislocated or fractured, but sometimes they could be subtle ones, especially with the athletic ones where it's just a ligament injury. We don't see a fracture. We do see that there's a subtle widening of that joint there.
And what's the best way to diagnose this?
The best way to diagnose this is to get x-rays with weight-bearing x-rays, and that's how it often gets missed. It gets seen in the emergency department or the urgent care, and they just get a plain old x-ray. And sometimes with the subtle ones, you need to get a weight-bearing x-ray because it shows what our foot's doing with our body weight on it. And you can see that the bones actually change position with our body weight, and that's not a good sign.
Is there any time where an x-ray, just because it might be a slight fracture or a stress fracture, where maybe an x-ray wouldn't pick it up? Maybe you have to do a CAT scan or bone scan. I'm not even sure they even do bone scans anymore. But, I mean, any kind of enhanced diagnostic testing you might want to do?
Yes, so advanced imaging is pretty important. In some of the more subtle ones or some of the ones we're not so sure about, we'll get a CAT scan.
And in those subtle ones, is this a person who is going to be injured or have an injury? It's usually kind of an injury that they may or may not feel it, what you're saying, but they'll have pain and they'll have problems when they go to roll over and push off. Give me an idea of kind of the symptoms that someone might have a subtle Lisfranc might be experiencing that needs to get checked out.
Yeah, you're exactly right. So it's someone who thinks that maybe they just sprain their foot and then it's just not getting any better like a normal sprain would. They're not pushing off well, they're not bearing weight, they can't go down down the stairs. Just some signs that things are not going that well and it's not a normal sprain.
And sometimes in that midfoot area, if it's a slight sprain, sometimes it's hard to pick up swelling, but can there be some swelling if it's a significant sprain?
Yes, it could be swelling and, in fact, some bruising.
More with Dr. Kenneth Chin right after this timeout on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
We continue our conversation with Dr. Kenneth Chin and Shannon O'Kelly talking about Lisfranc surgery on Como.
Dr. Chin, again, thank you for joining us on Health Talk, and we're talking Lisfranc injuries. We've talked about kind of the type of injury or mechanisms, signs and symptoms. Let's talk about, I'm a patient. I've had my diagnoses made. I have a Lisfranc. Let's talk about the a slight sprain of the Lisfranc and that treatment versus the fracture. So let's talk about a slight sprain right now. How do you treat it?
So mild sprains we often treat conservatively without surgery. So we will treat them either in a cast or a boot and a period of non-weight bearing where they're on crutches or one of those knee scooters to let the bones and ligaments heal up on their own.
And that slight sprain or fracture, a timeline for that to heal, about 6 to 8 weeks plus or minus?
Exactly. 6 to 8 weeks, exactly.
And what about an athlete wanting to return to play after a slight injury?
So it kind of depends. We like to let things heal up. We don't want it to become a recurrent injury or something that displaces further and becomes a surgical problem. So I go pretty slow. I want them to really heal up. Usually that's the full 6 weeks.
Okay, good. What about a fracture, something that you have to go in and repair? And let's talk about that and that intervention.
So there are a ton of different ways to fix them. So for the more unstable injuries or the ones that just don't look like they're going to hold up with conservative management, we do often operate on them. That usually involves making an incision over the area where the injured ligaments and bones are, and we usually have to put them back together with plates and screws, or sometimes even a cable, and that holds all the bones and ligaments together.
And this is a longer recovery. This is a more intensive and aggressive type treatment because of the fracture.
Exactly, and usually it's a long time of non-weight bearing. It's about 10 weeks of no weight on that foot after surgery, so it's a tough recovery for patients.
And is the length of non-weight bearing because of the area of the fracture and the type of fracture? And what about blood flow to those bones? Are those bones supplied well with blood? Because a bone that doesn't have a good blood supply sometimes struggles to heal.
So there's a decent blood supply in the area. There's other areas of the foot where there isn't a great blood supply, but this area has a good blood supply. It's just there's so much forces around this area because it's in the middle of the arch of the foot. So there's a lot of tension forces here that can really pull on the repair. So we have to really make sure that things are starting to heal up before we let people start walking on it.
Is this a fracture type injury that you'd see in high school, collegiate, or adult athletes, or is it a combination all over?
Combination all over. It doesn't happen a lot in the pediatric population. I would say adolescents and up, that's where it gets patients.
You know, I've seen a lot in those athletes that have to come up on that midfoot, almost like a lineman when they go to block. I mean, it's that kind of athlete, really a lot of weight bearing and rotation on that midfoot. That's really who's susceptible?
That's really common, yeah. So it's most common in football players, and linemen are the most commonly injured position.
Yeah, tell us the history. I mean, it's an interesting history where the name Lisfranc came from. A little trivia here.
So Lisfranc was an old French obstetrician and surgeon in Napoleon's army hundreds of years ago. And he would take care of all these soldiers who would have these injuries. And they would, their classic injuries, they'd get their foot stuck in their stirrup of their horse. And unfortunately, at that time, the treatment was an amputation, and Dr. Lisfranc would amputate the foot at this area, the Lisfranc's area, which we don't amputate. We have better ways to do it.
Yeah, we've come a long way. Yeah, classic stuff. Again, Dr. Chin, thank you for your time and great information. I mean, you described it wonderful for our listeners. Thank you.
You're very welcome. My pleasure. Thanks, Shannon.
We've been talking about Lisfranc surgery. Dr. Kenneth Chin is an orthopedic surgeon for the University of Washington Orthopedic and Sports Medicine Clinic. You can get more information at uwmedicine.org. Is this a fairly common condition?
You know, it's not real common. It happens, particularly in athletics, and when it does happen, it takes time. It's a biological thing to heal and return these athletes to play.
All right, Dr. Chin, thank you so much. David Escobar coming up next on Como.